Good evening, Prof.
Good evening.
Prof, I see that you've been conferred an honorary degree, a proper scientist who's been conferred a law degree. Just tell us about that briefly.
Well, it was a very big surprise, and part of the reason why I was given a law degree was because of my drug regulatory work. Okay. So Rhodes has a very long, a very distinguished history in pharmacology and in law. And so the work I've done over many years, first with the Medicines Control Council, now with SAPRA and other global bodies, I think resonated with those schools and faculties here at Rhodes, and that's why I think they recognise me most honoured.
So the regulatory work that you've been doing is basically part of the reasons why you've been honoured today?
Yes, that and the research work as well. So I think it's a combination of both of those things, and I think there was also note made of the recent work I've done in response to the COVID pandemic, both in the country and globally.
Wow. Now, Prof, your life's work speaks to basically contributing to a continuous process of development of a democratic state, particularly when we focus on the rights of women, reproductive health and the prevention of HIV. Can you just tell us briefly about that?
Well, I often wonder whether I was an activist first or a doctor first, and it's quite difficult to sort of separate the two things. Yes. But certainly from a very early stage, even before I qualified as a doctor, I really did have a passion for human rights, as you say, for women's rights as well. Yes. And in a way, medicine was an opportunity for me to not only have the skills of a clinician, but also to be able to express my very strong feelings about dignity, rights, and that people's health is much more than just whether they have a cough or they don't have a cough. It's about their environment, where they live, and what they have access to. So you cannot disaggregate rights, poverty, and health. So for me, it makes sense that these things come together.
Now, Prof, on this very subject, according to you, measuring in relation to the work that you've done, do you think that women have reached a stage where they've achieved a total space of freedom to be who they want? Because, you know, when we speak to reproductive health, we're talking about the growth of a nation. Is reproductive health finding expression in a space where women are doing it enjoyably and without hindrance?
I don't think that women have reached an equal state in terms of gender rights, by no means. South Africa has come a very long way, and you know, our representation, for example, in Parliament is a recognition of that. And if you look at higher education, tertiary institutions, including here at Rhodes, you've got a lot now, in many cases, more women graduates in some fields than others. But in terms of society, if you take South Africa, gender-based violence has got worse. You know, prosecutions for gender-based violence just are a fraction of what is happening. When we see stress in society post-COVID with levels of poverty going up, we also see levels of gender-based violence going up. But if we look globally, I think that in many ways we've slipped backwards. There are many societies now where actually it is okay to remove women's rights. So we are not in any way where we should be, and the voices of women, the voices of all activists, men and women alike, to continue to demand equity, respect, dignity and safety for people of all gender identities is incredibly important.
Wow. Now, Prof, just moving a little away from this subject and more to the pandemic that we faced over the past 2 years. The question I'd have right now, because it seems things have settled, where the world is no longer under the strain that it was a couple of months ago. Do you think we should prepare for something in the future that could be as disruptive as COVID was, or are we in the clear right now?
Well, I think COVID is a big warning sign. We've said for many, many years that we need to watch out for pandemics, and this isn't the first pandemic we've had. A few years ago we had pandemic flu. We had a huge outbreak of Ebola, not a pandemic, but a huge regional outbreak of Ebola in a way that we hadn't seen previously. So COVID, in a way, was something that was waiting to happen. We knew it would happen. It was a respiratory virus. It spread around the world incredibly quickly, and it changed incredibly quickly. I think we're all sort of sitting back and having a little bit of relief, because what we're seeing now circulating is Omicron, which, although is highly infectious, is not causing such severe illness. And across the world, if we test people's blood in this room, most of us will have antibodies to the COVID virus, either because we've been infected in the course of the last 3 years, or, and I hope, because we've had the vaccine, or both. So we've got high levels of protection. We've still got a lot of COVID, and we've got a lot of Omicron, and we have to watch that space, because this virus is very good at changing. But having said that, as I said, this is a flag in the ground, and the world is now looking very hard, and I'm working with the World Health Organization in different ways to say, what are the lessons learned? How do we better prepare the global architecture, the global governance, the global legislative framework that would allow us globally to respond better than we did for COVID? And that includes not allowing what happened in COVID, which was that the African region was left behind. We didn't get vaccines when we should have got them. Rich countries were hoarding vaccines, and then only when they realized they didn't need that many vaccines were they then delivered. So there are many, many lessons, but for this region, not only do we want to sort of demand equity, but we're now saying we need to manufacture drugs and vaccines ourselves. And we need to be ready for the next pandemic in this region, because otherwise the risk of us being left behind again is significant.
Wow. Now, Prof, I want to talk about the past 4 decades of the work that you've done in the space and your activism in terms of trying to ensure that we attain liberty and democracy as a country. Considering the current state of affairs, what is your opinion of South Africa currently?
I think for all of us who are old enough to have gone through the sort of 70s and the 80s, the earlier anti-apartheid movement, and then all of the challenges that we went through in the 80s to eventually get to 1994, we were so optimistic, and things looked like they were going well. This is a massive disappointment that the country has been torn apart by corruption and by greed. And we need to call it out. Not only do we need to call it out in the criminal courts, but we need to call it out amongst ourselves to say that it's not acceptable. You know, that if we have neighbours or relatives that we know are involved with getting ill-gotten gains through exploitation, taking money out of the system, essentially taking money away from the people who most need it through corrupt means, we as a society also have to call it out, as well as the judicial system doing what it must do.
Thank you very much, Prof. Now, in conclusion to this conversation, you spoke quite fondly and passionately to the young people that were graduating today. Maybe a message that we can just record for them and share with them later on. What would you like to say to them?
Well, the first thing is they should feel, those who graduated today and all in the country should feel extremely proud of what they've achieved, because that is a personal achievement. But they shouldn't just see it as a line on a CV, a tick in the box. That knowledge is their knowledge. They can own that knowledge. That knowledge is theirs forever. But then it's what they do with it. And because of the state of the country and the state of the world with challenges such as climate change, for them to think through, with the new knowledge and the new qualifications they have, how they can contribute to a better country, to a better world. For them to sort of ask their internal question of, what do I want to do? Why do I want to do it? What is my ambition for myself, for my community, and for the country? And then really set out on a path deliberately to try and achieve that ambition.
Wow. Prof, thank you very much. We wish you well in your future endeavors, and congratulations on your degree.
Thank you so much.
Thank you.
I truly appreciate it.
Thank you very much. Thank you.